Gain an understanding of your growing baby. This crash course is intended for parents-to-be only. No medical diagnosis will be made in any way or form, and Blissful Glow Incorporated and any of its employees will not be liable for any information that you might interpret as a medical diagnosis. Blissful Glow's equipment is to be used for personal viewing of your baby, recording and storing digital media for personal keepsake purposes.
Sound is simply a series of vibrations or waves that travel through the air and can be heard once they reach the ear. When these waves are very tight, meaning that they vibrate at high frequency or are far apart vibrating at low frequency, humans cannot hear the sound. The process to create an ultrasound image is fairly simple. First, the transducer produces high-frequency sound waves that the human ear cannot hear. Those sound waves travel through the body and bounce off different tissues. In this diagram, the transducer is on the left and the mom is on the right. The red lines represent the sound waves sent into the body by the transducer. The green lines are the reflected sound waves that return to the transducer from the body. These reflected waves are called echoes. The reflected echoes go back to the transducer and the computer analyzes these waves and builds an image. On the left is an image of the mom learning to operate ultrasound on herself. The transducer is in her right hand. The image on the right is what is seen on the screen. Notice the many different shades of gray in the image of the fetus. We see black, white and shades of gray on ultrasound because the sound waves react differently to different tissues and fluids. For example, sound waves tend to pass through fluids without reflecting back to the transducer. This means that fluid tends to produce no echoes. In contrast, sound waves cannot penetrate bone or air, so they are reflected back strongly and produce strong echoes. Soft tissues are somewhere in the middle. Some sound waves pass through and some reflect back. This is a second trimester fetus, placenta, and amniotic fluid. Sound waves pass through the amniotic fluid without reflecting back, so amniotic fluid appears black. The skull is white because most of the sound is reflected back. The placenta is soft tissue, so some of the sound passes through and some reflect back. This is why it looks gray. The fetal abdomen is also gray because it is soft tissue. Bone and air are the most echogenic and will appear white. Fluids, including blood, amniotic fluid and urine in a bladder, will appear black. Soft tissue will appear gray. These are different views of the fetus. What color are bones? The bones are white. In these images they are the skull and femur. If something is black, what does it mean? In these two images, the black structure is a bladder which is fluid-filled. Other structures that should be noted here include the white color fetal spine on the left and the uterus on the right.
Imagine if we sliced a knife through this box towards the front and then towards the back. Those slices would look like S1 and S2 here. Ultrasound takes images in the same way. An ultrasound shows only the objects that you sliced through. A sagittal plane divides the body into right and left sides. This is the plane when the transducer is oriented towards the mom's head. A transverse plane divides a body into top and bottom, which is how we always begin an ultrasound scan. This is the plane when the transducer is oriented towards the mom's left side. The coronal plane divides the body into the front half and the back half. Please locate the marker on your transducer or on the screen. When correctly positioned, the transducer marker should always be towards the left side of the mom or positioned towards the head of the mom. When doing a sagittal or longitudinal scan, face the marker towards the mom's head. When doing a transverse or cross-section scan, face the marker towards the mom's left side. This is a transverse view of a fetal abdomen. Imagine that you are at the baby's feet looking up towards its head through the abdomen. This is how the abdominal area would look from that cross-section slice. This is a sagittal view of the fetus. Imagine that you are looking through the baby from its right side. This is how the baby's profile would look from that longitudinal or sagittal slice. This is an image of a fetus that its head down, which is longitudinal lie. Standard practice is to have the mother's head on the left side of the screen and her feet towards the right when you are scanning. Therefore, fetus has its head towards the mother's feet. When looking at transverse scan, imagine you are at the mother's head looking towards her feet. This is the stomach, heart and ribs. Notice the anterior side of the mother is at the top of the image and the mother's posterior is at the bottom. The mother's left side is on the left side of the screen and her right side is on the right side of the screen. You want to begin your scanning just above the symphysis pubis. In the image on the right, the pubis symphysis is located just beneath the mother's hand. To start a robust scan, take 3 sagittal scans from the symphysis pubis below the abdomen to the upper abdomen. The first scan is the midline, the second to the mother's right midline and the third to the mother's left midline. It is important to use adequate gel for contact with the skin. Next, take 3 transverse scans, scanning from the maternal left to maternal right. The first is just above the symphysis in lower abdomen, the second in the mid-abdomen, or mid-uterus, and the third across the upper portion of the uterus. This will be in the upper abdomen in the 3rd trimester of pregnancy.
This is a sagittal profile of the fetus. Because the skull is bone, it will appear white. Here we can see the face and a skull. This picture shows the skull in transverse. The skull is oval on cross-section. This is what the face looks like in profile very early in the 2nd trimester. Which features of the head and body can you clearly identify? Here we have labeled the skull, forehead, nose, body, spine and leg to make them more obvious. Here is what the face looks like in an older fetus in profile, which is called a sagittal image. Can you see detail in the fetal face? Here we have labeled the forehead, nose and lips. Now we are going to look at the brain. This is the transverse image of the fetal head. In the 2nd and 3rd trimester, you can clearly see the heart beating. Here is transverse or cross-section through the chest. You can see the 4 chambers of the heart. We have placed star in each of the chambers to mark the location. These views of the chest show small white structures. These are ribs, which are made of bone. Please also notice the heart and stomach. This is a transverse section through the abdomen. Let's point out the stomach in each image. The stomach is black because it contains a fluid. The stomach normally varies in size. When you look at the fetal abdomen, you often notice the umbilical cord. The cord is attached to the fetal abdomen and the placenta. The image on the left shows the umbilical cord inserting into the abdomen. Here we point out these structures to make them more obvious.
The image on the right shows the umbilical cord in cross-section. The cord normally contains 2 arteries and a vein. You can see the vessels as round black structures. We have labeled the umbilical cord here to make it more obvious. The bladder contains urine, so it is black. It can normally be different sizes. The left image is a coronal view of the bladder, the right image is a transverse view. It is sometimes easy to confuse the bladder and the stomach, both are black. The bladder is low near the legs, the stomach is high near the ribs. We point out the heart in both of these images to further help orient you. These are transverse views of the fetal spine. The spine is at the back of the fetus. We have outlined them here to make them more obvious. Now we finish with the extremities. The arms and legs are often well seen because those are white. Here we can clearly see the hand, forearm and upper arm. Here is a nice image of a lower leg and foot. Notice that there are 2 bones in a lower leg. The larger bone is called the tibia, and the smaller bone is called the fibula. This makes it easy to distinguish lower leg from the thigh, which has only 1 bone, the femur. Here is the view of the pelvis and thighs containing just 1 bone in each extremity, which is called the femur. Notice that there is no second bone next to the femur. If you see a second bone, you are not looking at the femur.
And finally, the most important question. Is ultrasound safe? According to various official leading government agencies and medical organizations in the USA, Canada, and Europe, there's no evidence that ultrasounds harm a developing fetus and that scientists aren't sure if non-medical long-term ultrasound exposure is potentially dangerous.